So let's talk about necrosis. So necrosis is the pathological demise of the cell. Now this is an unregulated cell death, unlike apoptosis, which is regulated by certain genes. So necrosis is basically a lethal response when the cell is injured by the body, and that causes the membranes to fail. Now when the membranes fail, the ATP depletes, and because it leaks out of the mitochondria and the cell membranes, and the lysosomal enzymes also leak out of the lysosomes because of the failure of the membranes. That along with the influx of calcium and accumulation of reactive oxygen species wreaks havoc in the cell basically, and there's also accumulation of abnormal proteins, so that ultimately leads to the death of the cell. Now all of these events lead to other events as well, but there's no clear-cut step-by-step process. It all happens simultaneously. Now, there are some microscopic changes that can be seen in necrosis. So first, the cytoplasmic changes are that the cells become more pink than usual, which is called eosinophilia, and the vacuoles appear moth-eaten, basically, and there are more vacuoles than usual. Also, there are some changes in nucleus, like there is pycnosis, which is actually the shrinkage of the nucleus. There's karyorrhexis, which is fragmentation of the nucleus, and there is karyolysis, which is dissolution of the nuclear material. Now there are some patterns of necrosis. So first is the coagulative necrosis, and this type the architecture is preserved because when there's necrosis, the enzymes of the cell are also denatured, so proteolysis does not occur, and due to that reason the texture is firm, that is the same as the original healthy tissue. Now a localized area of necrosis, as you can see in this diagram, this wedge-shaped area of necrosis, that is called an infarct, right? So this is a picture from Robbins, and over here you can see the normal kidney on the left hand side and the necrosed kidney on the right hand side. And if you see closely, the outlines of the cells are preserved, but there are no nuclei in those cells, and there is inflammation between the cells if you see closely. So that is the typical picture of coagulative necrosis. Now, whenever there's ischemia in a blood vessel, then the part supplied by that vessel undergoes coagulative necrosis, except in the central nervous system. Why that happens is not clear, but usually liquefactive necrosis occurs in the presence of infection. So what happens is that if there's an infection, then leukocytes accumulate, and those leukocytes release certain substances which cause the digestion of the cells. That causes liquefaction, and basically that is why it's called liquefactive necrosis. So the liquefactive material is creamy yellow, and it's usually called pus. The third is gangrenous necrosis or gangrene. So gangrene is a clinical term, and basically it refers to when the necrosis is in multiple planes in the limbs usually, although gangrene can also happen in the bowels, but usually when we say gangrene, we refer to the limbs. So it is a combination of coagulative necrosis and liquefactive necrosis. Mostly, if there's mostly coagulative necrosis, then that is called dry gangrene, and that indicates that there is no infection, and that happens in conditions where the blood flow is compromised, such as in smoking and peripheral vascular diseases. When there's more liquefactive necrosis, then that indicates that there is a superimposed infection, and it's called wet gangrene. So wet gangrene is seen in diabetic foot, necrotizing soft tissue infections, basically all those conditions where there are chances of the coagulative necrosis getting infected. Then there's a third type called gas gangrene, which we'll discuss later in more detail. So the management basically consists of fluid resuscitation and IV antibiotics and debridement and amputation in severe cases. So gas gangrene. So gas gangrene is actually, if you see the red diagram, so when it's a type of gangrene in which there is gas between the tissue planes, right? And it is caused by C. perfringens. So it is defined as rapidly spreading edematous myonecrosis, and two prerequisites are required for gas gangrene to occur. First is you need anaerobic conditions, and secondly, you need contamination by C. perfringens, which can be from the soil or the clothes. These anaerobic conditions can be present in crushing injuries, foreign bodies, and open fractures. Right. So, this is a picture of the right foot of a person that has undergone gas gangrene. You can see there is swelling and discoloration. Then there are these black colored bullae, and they have foul smelling serous sanguineous discharge. And there's also palpable crepitus and excruciating pain. So how do you diagnose it in the lab? So basically, you have to take deep samples. You have to take deep tissue samples and parts which are necrosed, but they should not be superficial. Otherwise, the result will not be ideal. So in microscopy, you can see boxcar-shaped gram-positive bacilli without spores. These indicate Clostridium perfringens, and culture is done on Robertson cooked meat broth in anaerobic conditions. The treatment is early debridement and delayed closure of the wound. So basically leave the wound open for some time. Then you give antibiotics for 14 days, IV antibiotics, and a combination of clindamycin and penicillin. You also give hyperbaric oxygen to basically clear the anaerobic organisms, and you give passive immunization by anti-alpha toxin antiserum. Then there's caseous necrosis. Now, this is the picture of a lung, and if you see the picture closely, then there's a friable white cheese-like appearance. So, due to the fact that it looks like cheese, that is why it's called caseous necrosis. Now, typically, it is seen associated with a granuloma, such as in TB. So, this is a granuloma, and the pink amorphous area that you see is the area of actual caseous necrosis. And it's basically a collection of lysed cells and debris. And there's a collar of inflammatory cells around it, right? Then there's fat necrosis. So, fat necrosis actually happens when there's in a condition called acute pancreatitis. So, in acute pancreatitis, there's a leakage of pancreatic lipases, which causes liquefaction of the fat cell membranes. Now, that releases free fatty acids, which combine with calcium and form chalky white deposits, which are called fat saponification. Microscopically, the calcium deposits are basophilic and there's inflammation. Then there's the last category of necrosis, fibrinoid necrosis, in which you see deposits of immune complexes basically in the tunica media, and these immune complexes combine with leaked plasma proteins to form an amorphous ring-like substance, which is the picture of fibrinoid necrosis, and it is often seen in vasculitis.